Very good morning, doctors. Very good morning. And one of the doctors named Shashi, his name is, I think this doctor asked me something like, sir, you explained everything about depression. Yes, obviously I explained. And also the treatment. Yes, treatment also I will explain. Sir, but we got an MCQ regarding resistant depression. Resistant depression, okay. But in which MCQ? Neet PG or Inicet? You did not refer here. Okay. So please explain something about resistant depression. Okay, what you want something? Okay, so okay guys, so as our Sashi has asked, we will discuss about resistant depression. Resistant depression is nothing but depression which is very much hard to be treated, right? It has a different term. I will speak in the next class. So I will speak it in general. This resistant depression is generally seen in something like 10 to 20% of the patients with depression. These patients have a resistant depression which is very much hard to treat. Okay, so what treatment that you can give? So something should be given now, even though it is hard to treat, even though it is chronic, you should give something to treat it. So what treatment we will give is combination of, remember very important, combination of antidepressants. Okay, we will give a combination of antidepressants, but remember one thing, while giving this combination of antidepressants, you check for something called serotonin syndrome. You just simply monitor the patient if he might be land up in serotonin syndrome, very problematic syndrome. Okay, in the next class also I will tell you something about cheese reaction, something which is related to this condition. So while giving a combination of antidepressants, always monitor for any chances of serotonin syndrome. Okay, next you may also give low dose of antipsychotics or lithium or thyroxine. Yes, thyroxine also you can give, or folic acid. Okay, but some may get a doubt what these will do. What this folic acid will do? Simply I can say only one answer, it will support or augment the effect of antidepressants. It's a simple answer, it will augment the effect of antidepressants. Okay, simple answer. Now what are some other methods? Low dose antipsychotics, please. You can also give ECT, electroconvulsive therapy. This can also be given. Now you can give something called RTMS. Either you know the definition, I mean abbreviation, you know or not, I don't know. But it is something called repetitive magnetic stimulation. Repetitive magnetic stimulation. See, we don't want anything which is beyond the depth. Just go as much deep as possible. That's it. Next, you can also do vagus nerve stimulation. You all know this, I think. You can also do vagus nerve stimulation, right? And there is something called light therapy. Not the light therapy you see in Orange movie that was acted by Ram Charan. No. This light therapy is different. This light therapy, it's actually a treatment of choice. This one you remember. This light therapy is actually used as a treatment of choice in seasonal affective disorder. Remember this statement, very important. Seasonal affective disorder. Okay. Now with after this light therapy, we can also give one more drug called esketamine. Esketamine, which is used as a nasal spray. esketamine nasal spray, right? These are the treatments for resistant depression. But if you ask me, because some people actually want to know this, sir, what antidepressants are used for depression? Please explain this, sir. What antidepressants are used for depression? First ones are always SSRI, selective serotonin reuptake inhibitors, but they have some side effect profile which you should learn, very important. First one is GI disturbances like nausea, vomiting, diarrhea, all these things. Second one is sleep disturbances. I will just write the main headings, rest of the things I will tell verbally. Sleep disturbances that include insomnia. Insomnia means sleeplessness, sedation and vivid dreams. Vivid dreams are seen. Next you have some sexual disturbances, sexual dysfunction. Okay, also you can simply write sexual dysfunction. There will be a decreased libido, erectile dysfunction, as well as delayed ejaculation, and also in some males you also see anorgasmia, means it's mostly seen in women. Anorgasmia means this patient won't reach to orgasm. Orgasm is something which you get a pleasurable feeling when you reach to the climax of the sexual activity. So that is called as orgasm. All the muscles present around your main genital regions get contracted. In males it leads to something called ejaculation. The women also same leads to orgasm. But in the women, mostly in women who are using these SSRIs, they may have a problem of anorgasmic, means they don't reach to orgasm. How much activity you do, but still they don't reach to orgasm. Okay. Now what are the drugs we use, right? Besides SSRIs, what are the drugs we use? We use something called bupropion, which is a NDRI. What is meant by NDRI? Noradrenaline dopamine reuptake inhibitors. Noradrenaline plus dopamine reuptake inhibitors. Okay. Now what is the specialty of bupropion? It has least sexual side effects. But can you tell me why it has the least sexual side effects? Due to no action on 5-HT, no 5-HT action, 5-hydroxytryptamine action is not there. Okay, so it doesn't cause any sexual side effects. Now you have some more drugs called trazodone. Okay, trazodone, but trazodone side effect is priapism. Next, one more drug is paroxetine. Paroxetine has the maximum withdrawal symptoms, presents with maximum withdrawal symptoms. But if you take fluoxetine, it has least withdrawal symptoms. It possesses least withdrawal symptoms. And one more drug that you can use is one more family of drugs, SNRI, selective norepinephrine reuptake inhibitors. So what are those actually? They have a special feature of dual action. They have a special feature of dual action antidepressants. They have a special feature of dual action antidepressants. Means what? Can anyone tell? What is that mean? That means they increase norepinephrine. They increase norepinephrine and 5-hydroxytryptamine. They increase 5-HT and norepinephrine. But what is the side effects? Can anyone tell? What is the side effects? Increase of norepinephrine leads to what? Increase of norepinephrine leads to what? That is the side effect. Increase of norepinephrine leads to hypertension, because norepinephrine is a catecholamine. Okay, na? It's a neurotransmitter which induces increase in blood pressure. Okay. Now that is all about the antidepressants that are used for depression. Okay. So I think that's okay with this topic. This is your wise doctor.